Hi, Ineke Kersten is joining me from The Hague in the Netherlands, where she's a psychologist and she works in a private practice and also at a hospital in Amsterdam. And she is a practitioner and trainer in logosynthesis, and she's here today to talk to us about her work, which is in the area of logosynthesis and trauma. So thank you so much for joining us, Ineke.
Thank you, Cathy, for inviting me to tell something about logosynthesis and trauma.
Good, thank you. I'm always interested to learn how people were introduced to it and what sparked their interest to train in this model. Can you tell us a little bit about that?
Yeah, well, that was like 10 years ago, around 2011. Two colleagues of mine introduced me to the world of logosynthesis. And I was working with one of them on the editorial board of a professional journal. And because of this, we had regular meetings and always asked each other, how are you doing? And every time I told her about something that was bothering me, she would answer, oh, but it doesn't have to bother you at all, you know. You can apply logosynthesis to resolve it. And I've never heard about it. But during that same period, another colleague wrote an article in our journal about logosynthesis, again, logosynthesis. And that's how I became interested. What kind of method is this? And it seems to be able to solve any problem. And well, to be honest, I was rather skeptical, as if you don't have to suffer anymore. And I had been trained before in a psychotherapeutic school where suffering stands central to the work with clients, psychosynthesis. And I had done 5 years of training and learning therapy, during which I had learned so much by facing my own suffering in order to be able to work with it with my clients. And the message of psychosynthesis is through suffering, you can achieve transformation. And suddenly I'm told that you have suffered enough and that you can break through pain in a quick and simple way. Well, I also consider the technique of logosynthesis a bit weird. You speak sentences aloud and then the tension disappears immediately from which you are suffering. Yet their enthusiasm touched me, so I registered for the 3-day basic training, which claimed that afterwards you immediately could apply the method to your clients. So no 5-year training. With all these question marks, I started the training logosynthesis. And after that first 3-day training, I thought, what a pity that I did not know about it earlier in my life. And since 2011, I work almost daily with logosynthesis, with clients in my own practice and in the hospital, especially with heart and cancer patients. And I also apply logosynthesis to myself. That's the handy thing about logosynthesis. You can also use it for self-coaching. And although my experience is that on my own, I don't get to the original cause as deeply as I should, but yeah, you need someone else to bring unconscious material to the surface. But for the daily problems, it works just fine. And I use it at the end of the day, like brushing my teeth, a daily ritual of cleansing. And the conclusion I draw from my own introduction to the world of logosynthesis is that it is necessary to hear about logosynthesis, well, something new, from different angles and preferably multiple times. So I want to thank you for your publishing work and for conducting these interviews, because the more people hear or read about logosynthesis, the more people will become aware of and curious about logosynthesis. And as a result, both clients and therapists will benefit.
I agree with that. I think the more we can hear about it, although I know sometimes my friends get a little annoyed with me when I say, oh, that doesn't have to bother you anymore.
Like
I
that
have a few
first colleague.
sentences for you. Yes.
Yeah, I like that first
And
colleague of
I
mine every time. Yeah.
And I
Yeah.
think a piece of it is that we just get so excited to share, and it's such transformational work, and you see so many people benefit from it that it is an exciting model to share with others. And I know that logosynthesis is used to support a wide variety of concerns. And from a coaching perspective, we generally work with it to help resolve limiting beliefs and fantasies about what might happen, those fears about, what could go wrong. And we tend to work in a more forward facing. And from a counseling and therapeutic perspective and dealing with trauma, I understand that you go more into the painful memories and those kind of adverse experiences that children often have, and look at those images and sounds that can cause such distress and continue to cause distress in our lives, right?
Mhm.
And so is logosynthesis your preferred model to work with people who suffer from trauma? And if so, why?
Uh-huh. Uh-huh. Well, first about formulating your question, because I hear you distinguish between looking into the future, like more coaching, of counseling, coaching, and looking back to the past. As a therapist, I listen to the way a client talks about his problem. Is the story primarily about the stress someone is experiencing because of real past experiences, or does the client suffer more from what might happen in the future? And everything that is experienced as difficult in the future takes place in the imagination. It is fictitious, but it can limit you in the here and now in doing what you really want to do in life. And logosynthesis calls this imagination about the future fantasies. To make clear that we're talking about the imagination in our own head, not about reality here and now. And for a therapist, it is important to connect to where the client's attention is at that moment, in the future or in the past, based on the stress someone is experiencing at that specific moment in the here and now with you together. And I believe that as a therapist, you should always look for the source of the problem in the past. If you do not neutralize the stress of the past experience, problems will continue to repeat themselves during a person's lifetime. And in trauma, we see this very clearly. Experiences from the past seem to repeat themselves continuously. In severe trauma, with PTSD and post-traumatic stress disorder, we see this happening in the form of reliving the situation over and over again. And this re-experiencing the trauma means that people are set back into the past environment with all the emotions of that past traumatic event as if it is happening in the here and now. So you can understand that re-experiencing the trauma is very intense. For the client, it feels like not only he's reliving the trauma, but as if he steps right back into the trauma. And as a therapist, you want to break through the situation as quickly as possible. And yes, for me, logosynthesis is the fastest and most effective way to achieve this. Logosynthesis works with frozen energy, and we see trauma as frozen energy, as a frozen memory out of the past. And because it works so quickly, a client doesn't have to suffer for long. And I prefer logosynthesis almost always in my treatment these years. For any question, and yes, I still work with psychosynthesis as well. And the most difficult thing for the client dealing with trauma is to go back into the picture of the traumatic event, to the painful memory. And that's necessary to process the trauma. By doing so, you activate the trauma, especially if you focus on one specific detail. What do you perceive and how do you perceive it? Do you see this happening? Do you hear something happening? Do you smell or taste something? All senses play a role in memories. And as soon as we know which sense is, as soon as we know which sense a distressing memory is being relived, you can already apply logosynthesis. The moment you find the right trigger, logosynthesis works very quickly and effectively. The protocol we work with is clear and short, And a basic principle of logosynthesis, and I love it, is less is more.
I agree with that. Yes, I said that less is more is sometimes a little difficult because our training is often, let's learn more, let's give them more, and that can take some adjustment. Yeah. So in the book, Thriving in Our Times, From Reactions to Action Using Logosynthesis, you describe a powerful example of how you helped Emily, helped her feel better after she was attacked in a park. Can you tell us a little bit about this case and what happened for Emily?
Mm-hmm. Yeah, for this case, it is important to mention that I already knew Emily from my work as a psychologist in the hospital. Emily had suffered a heart attack a few weeks before and was already talking to me as part of her recovery. And having a heart attack is experienced by many heart patients as a, smaller or larger trauma. A heart attack often occurs acutely and suddenly, and in the hospital, an intervention takes place very quickly, like a doctor treatment or a bypass operation. And if there are no complications, especially after a daughter treatment, people sometimes return home the same day. So it all happens very quickly. And it is when they are back home that people become aware of what happened to them. They often experience the time of the heart attack and the intervention itself as a movie, as if it had happened to somebody else. And that's a healthy kind of dissociation, I always explain, where feelings are momentarily extinguished. It is a handy survival mechanism which ensures that, for example, the ambulance staff can do their work. Some patients manage to block these feelings for a long time, and you can recognize this in statements such as, I don't believe that this happened to me. They say I had a heart attack, but I really can't imagine that they are talking about me. But for most heart patients, the awareness of what really happened comes during the period of cardiac rehabilitation. And our hospital offers a cardiac rehabilitation program which focuses not only on physical recovery, but also on emotional and psychological recovery. And cardiac patients can participate in physical training, in information meetings, and they can also follow a course on self and stress management. And Emily attended that course, and that's where we got to know each other. And after the course, she said she would like to talk to me individually, so we get to know each other. And the heart attack literally brought Emily to a standstill. This led to many questions about her current life, about her relationships, her job, the reintegration process, about what she finds really important in her life. But, and there's the case, at the same time, another acute, unfortunate incident happened to her. Emily was attacked in a park during her evening walk. And she considered this walk her, as she calls it, the precious moment of the day. She experienced it as meditative, and it offered her some time to herself. And now this precious walk had been taken away from her because she was in the wrong place at the wrong time. She had been attacked from behind by an unknown man for no reason at all. She was knocked down and punched in the face. Her nose and left ankle were broken, and she had severe abrasions in her face. When I brought Emily from the waiting room to my room, it was nice for both of us that we already knew each other and had established a strong working relationship. I knew her as a very open lady who also dared to show her emotions to me. And that happened now too, after this incident in the park. She came to me and immediately began to tell her story about what had happened to her the week before. And I immediately started to apply logosynthesis. She was familiar with the method, had confidence in me as her therapist, and could surrender to the logosynthesis method. In trauma work, the working alliance between therapist and client is even more important than usual. And after experiencing trauma, the client's trust is damaged. Most don't feel safe. Relationship with a therapist can help rebuild that trust and safety. And fortunately, I have logosynthesis as an instrument that supports me in this, which can make this recovery process speed up. So Emily and I treated all the incriminating triggers with logosynthesis. As a therapist, you look for all the memories where the film with the trauma stops, so to speak. In logosynthesis terms, we say where energy is frozen. And this can be in an image. In Emily's case, this was the image of this man walking away. This can be in a sound, hearing his approaching footsteps from behind. The feeling of the slap on her face and falling down hard on the ground. And after this session, she was still actively processing by herself. She applied exposure by going back to the park where she had been beaten up. And she told me afterwards that it was scary to do so, I can imagine. But she noticed there that she could still experience the park as quiet and meditative. And she now realized how much power she has within herself. She can now process this terrible experience without feeling overwhelmed. A few weeks later, she was doing well, both physically and emotionally, and she could look back at the event with a certain distance. That's important to hear. She no longer re-experienced the event, and she tried to give meaning to what happened to her with a new perspective. Like, well, if I can forgive this perpetrator, I may forgive myself more often. She also felt a great bond with her parents who took such good and loving care of her these weeks. So it was very impressive to work with her.
Yeah, and it's nice to see people be able to find that distance, because so often, even if it's an event that happened years and years ago, it seems that it takes them right back to where they were in that moment. And to be able to get that distance gives them such a feeling of relief, I think.
Mm.
Yeah. So Emily's trauma was one specific and recent event, but many of the people that you would work with, or many people who experience trauma, it's a result of repeated experiences over and over again. And many have happened a long time ago, in childhood often, and they continue to trigger this distress today. So how do you use logosynthesis to support these situations?
Yeah, before I can answer this question, it might be good to briefly consider how exactly we define trauma. After all, everyone has suffered smaller and larger traumas in their lives. And with logosynthesis, we treat these painful experiences basically in the same way. We look for the trigger of the stressful reactions. We neutralize this trigger with logosynthesis so that someone no longer has to suffer from what happened in the past. And the result is that they can use their energy again for what they find really important in their life. But trauma with a capital letter, multiple or complex trauma, is more complex to treat. We see complex trauma, and I give this definition, as a response to an inescapable stressful event far beyond human coping mechanisms. In other words, as I see it then, a traumatic event lies outside the normal range of experience and cannot be processed and integrated in a normal way. You can imagine that complex trauma suffered by people at a young to very young age has far-reaching impact on adult life, on how somebody thinks about himself, about others, and about a world in which something like this can apparently just happen. The burden of trauma often manifests itself in reliving the event over and over again. In reliving the moment, someone experiences the same trauma over and over again as if it were happening again right now, with all these same intense, threatening feelings from back then. A reenactment can happen in the form of nightmares, flashbacks, intense emotional and physical reactions similar to when the traumatic event took place. People who suffer from trauma are therefore extremely alert and watchful, as if something terrible can happen again at any moment. The body is chronically stressed by this continuous state of alertness. And then back to your question about how we treat complex trauma with logosynthesis, you will understand that the most important thing in complex trauma is building this safe working alliance with the client. That's the starting point for the treatment of trauma. The client will need to gain trust in the therapist before opening up and dare to show his vulnerability. So trust is a necessary condition to treat trauma. The therapist needs to create safety, and for example, by first giving information about PTSD, about how people often react to such an extraordinary experience, also what they might be going through therefore belongs to the situation that happened to them, etc. And the second important condition in treatment of complex trauma is that you start stabilizing the symptoms, the reactions. Client must learn to take care of himself. So I discuss, for example, helpful coping mechanisms, or I do mindfulness exercises, create support. So processing traumatic events is only possible if someone is sufficient emotionally stable. A person must be able to take responsibility for his daily life before and after processing the trauma.
Could you tell us about a phenomenon that occurs in complex trauma, and that is dissociation?
A complex trauma victim can very well dissociate during a therapy session, and that is actually a kind of flight reaction. So when stepping back into the traumatic situation, it can become too much or too threatening for the client. And when someone dissociates, his attention is completely gone for a moment. And as a therapist, you notice this immediately because you will have lost contact with the client and there's no more eye contact. And the attention of the client is no longer with you, but is stuck in that frozen memory of the past, the traumatic moment from back then. Or the client has temporarily left to a safe imaginary place. That's possible too. This imaginary place could very well be the same fantasy environment where someone went as a child during, for example, sexual abuse. Someone is doing something terrible to my body, but I imagine that I'm not there.
Right. Yeah.
And during a session, the client can be pulled back into the memory, causing the same escape reaction as before. So as a therapist, you have to switch back. You can do so by just quietly waiting, or you can actively bring the client back to the here and now by, for example, calling her name. And then you have to rebuild contact and safety. And I often do an exercise to bring the client back into the here and now. Alternatively, you can ask, I lost you for a moment. Where were you? And dissociation can also happen, for example, when the therapist moves too fast in a session. As a result, the client may feel unsafe and leave to her own safe place. In logosynthesis, we always connect with the client. The client determines the pace and the situation he or she wants to work on. So before starting the process, we need preconditions. Building this safe working alliance, information which gives confidence and security. The client knows how to deal with possible reactions, and the client demonstrates sufficient stability to engage in the process.
Yeah.
So back to your original question about seemingly single trauma and multiple trauma. As a therapist working with trauma, you always have to be alert to underlying traumas. It sometimes happens that the client wants to heal a seemingly single trauma, usually something that happened recently. And then it can happen that during the session, more traumatic events surface. This can take the client by surprise. And especially with severe or prolonged trauma, we humans are very adept at ignoring or forgetting these terrible memories. As such, a very handy mechanism to get on with your life, despite everything that has happened to you. And suddenly there comes a moment when everything resurfaces. I see this happen with heart patients because they were suddenly threatened by death due to an acute heart attack or even reanimation. Similar threatening experiences surface. And if there are multiple traumatic events, you analyze first what happened when by making a timeline. You start in the current time and then work back to the past. And this gives the client an overview and gives him the choice which event he wants to work on. So again, the client determines the pace. The client chooses which traumatic event he wants to work on at that moment. And this is also important to build up trust so that the client feels safe. So the difference to working with multiple severe trauma and lighter traumatic events thus is the preparatory work, especially the working alliance, and the follow-up discussion and the integration that takes time too. So in fact, most of the work in long-term trauma is what we call the future pacing. And that's the work you do after the trauma has been neutralized. Helplessness is at the heart of stuck trauma. So when the client manages to break through this frozen memory with the help of logosynthesis, he regains his power. The client starts looking at himself, the other, and the world from a different perspective, very important. And you discuss what it means to continue living from now on without the burden of one or more traumatic events in the past. What does it mean for your life today and tomorrow? Someone with complex trauma has lived in a survival mode for years and often doesn't know how to live a normal life. Traumatic events affect body, emotions, beliefs, and behavior. So therefore, relationships and work. For example, a child which has been sexually abused for years, such a child has had trouble daring to trust other people, let alone dare to enter into a healthy relationship. In life, this will, of course, cause a lot of trouble. For example, when looking for a life partner, such a client must learn for the first time to enter into an open relationship, to feel trust in the other, to feel safe with another person. So how special could it be that such a client can have this experience with you as a therapist in a safe and trusted setting? And you can be an example of someone in whom the client dares to trust. And if someone feels trust in you, they realize that this can happen to someone else as well. And we call this post-traumatic growth. People experience positive changes in their self-image and start to revalue their friendships and can give attention to what is really important to them in life. They start living from a new perspective, from helplessness to taking control of their own lives. People set new goals and live more from the contact with who they essentially are, with their essence. So there's a lot to do by severe or complex trauma. Yeah.
Yeah, because it isn't just one layer, right? In logosynthesis, we work in layers and it's always from a starting point, I think, of, how do we suffer in the present or what's bothering us now?
Mm-hmm.
And when we are in that position and we can go back and identify and resolve those frozen triggers, then that allows us to have that growth. And I know, from so much training with Willem, the the most important thing he talks about is that working alliance. And sometimes that's something that we can assume is there, and maybe it's not as solid as it needs to be. And yeah, it's certainly one of the things I noticed with logosynthesis is so many people say the structure of the logosynthesis method allows them as a therapist or as a coach to feel confident to hold the space for the individual who is processing those really intense emotions, intense feelings,
And
intense
that's true.
physical sensations, right?
Yeah, that's true. The protocol really supports us.
Yeah, as opposed to opening up these painful memories and not knowing how to offer a person relief other than to just sit there. Because when the person actually does the sentence, and for really complex and early traumas, we can say the sentences on behalf of the individual, but that allows, allows us the confidence to hold the space to help the person through that. Yeah.
Yeah.
So I've always wanted to be supportive of people who have experienced trauma in their lives. And yet oftentimes I didn't really know how to respond, because when someone's experiencing something intense, sometimes that can trigger something in myself. And, I want to fix it for the other person. And that's not always possible. But this training and the personal work that I've done in logosynthesis has given me a much deeper understanding of what people are actually experiencing with trauma. And I don't get it right every time, but I have witnessed what's possible when people are supported and that space is held for them to resolve those frozen perceptions and to start to heal. And so a big piece of this is not only being there to hold the space for the individual, but also to understand what is possible. And the more we can understand what triggers these intense reactions, these intense experiences, then I think overall as a society, we can better understand how to create a supportive space for people to heal it. So what message would you like to share with people who have suffer from trauma, and also for those who support people in healing with trauma?
Yeah, well, if people hear this interview and recognize their own experiences with trauma, I would like to say to them, seek professional help, especially if you suffer from flashbacks. Flashbacks blow you back in time with all the intense emotions and physical reactions of the past. Nightmares maybe disturb your sleep, making you less able to perform during the day. You can really suffer a lot from what happened to you. And somehow you know, of course, that that terrible situation is long past, and yet every time it feels like you're in the middle of it, as if it is happening to you all over again. And it takes an awful lot of energy. So if you process these events, you will notice that you gain energy in order to do what you want to do in life. And then you start moving again, and the future comes back into view. Your life will start flowing again as it should, or even for the first time. You can really feel free to do what you want instead of dealing with the trauma that was holding you back. So, yes, seek help so that you can move forward again. And for those who wish to support others who have experienced trauma, like a friend or a child or maybe your partner, I would say just be there. Be alert to the other person, be alert to signs that could show that the other person is suffering. As mentioned earlier, nightmares might be a sign, but you can also think of sudden mood swings, like suddenly going from very irritable to very listless. And stress signals are just warnings. They let you know that there is something going on which needs attention. And try to, let the others seek help for this. As a therapist or a coach, you yourself must feel safe enough to work with this issue. If you don't feel safe enough yourself, a client can't feel safe with you either. Whether you can work with trauma depends on your knowledge and experience, and of course, your own process. That's why one of the seminars in our training to become a practitioner logosynthesis is about trauma. And well, to end on a positive note after this rather heavy
Heavy
topic,
topic. Yes, it's heavy.
a lot of people who go through something terrible or even traumatic can somehow let it go. That's a miracle. They can tell themselves, well, what happened then was terrible, but the moment is over and it doesn't have to limit my life. People have enormous resilience. They can process the event for the most part by themselves and move on. And sometimes with the help of the therapist, like Emily did. And that can also be a very courageous step forward.
Yeah. That's
Yeah.
awesome. That's awesome, Ineke. I certainly appreciate your insights with it. And we are human, and it's part of life that we, hopefully we don't experience really traumatic events, but that's part of being human. And so a big piece of it is learning how we can access our power to heal, how we can find the supportive resources to help us heal and move on, right, and grow from the experience. So yeah, thank you.
Yeah, nice that you mentioned these two words, growth and move on. Yeah, that's what we want. Yeah.
I grew up in a family where things happen, we moved on, but sometimes we have to kind of slow down a little bit and take our time to heal the past, I think, and move on maybe a little more compassionately or a little bit more aware of how things can impact us. So
yeah.
Awesome. So yeah, your work offers some very valuable information to help us, learn how to create a path forward. I have such huge respect for your work, and I know, the benefit for your clients in the Netherlands, but also, especially if you're a trailblazer in this logosynthesis community. You've been in this community for a long time now, and certainly the people in this group admire your work and benefit from your work. And I remember when early on I came across one of your case studies that you had reported on processing fear and trauma, and that was so concisely written, and especially for people who do appreciate the science of the evidence-based and that, which will come with logosynthesis, but it certainly was a nice, concise overview of what is possible with this model. So thanks so much. Thank you.
Yeah, well, thank you for giving me the opportunity to talk about this.